What's up, guys? Today we're going to go over different jaw surgeries and you will be able to tell which one applies to you. So the first case is of a woman who did a double jaw surgery because she had recession in the upper and lower jaw. So what they did is they made the cuts and they rotated both jaws at a higher position. So now imagine there's a clock. The before face, the teeth were pointing down at the 4 o'clock position. Now they point at the 3 o'clock position. That is a counterclockwise rotation. When they do this, there's a lot of lower jaw advancement and some maxilla advancement. Overall, she looks way more balanced and it has cured her sleep apnea. Next, we have a patient who did a double jaw surgery, but a lot of patients that have this face can settle for a lower jaw surgery. This is what you call an overbite. This is when your maxilla is in the normal position or is just more grown than the lower jaw. In most cases, the lower jaw is extremely underdeveloped compared to the upper jaw. Now, he could have done a lower jaw surgery and called it a day, but his overall face was compromised. Even his maxilla was very small. He's had so many teeth extractions by now. He has 1, 2, 3, 4, 5 or 6 teeth when you should have 8 on the upper. Same with the bottom. He has 1, 2, 3, 4, 5, 6 over here. So he's had multiple teeth extractions for this small jaw. In order to get him to a good profile, they had to do a double jaw surgery. So they advanced his maxilla, they significantly advanced his lower jaw, and did a significant genioplasty to give him a nice balanced profile. Right, so this is an extreme case, but for most people that are in the middle with an overbite, they can settle for a lower jaw surgery. But for best results and overall aesthetics, you should do a double jaw surgery with a genioplasty. Next, we have another case of a woman who has one side of her face smaller than the other. And this case is just like me. So one side of my jaw, I would say this one, is smaller than the right side. So the right side is more grown forward and is taller on the ramus. And it was pronounced after the Marpy, and it left me with a cant. Usually, if you have a cant, the higher side of the cant is the smaller side of the face because the ramus doesn't drop down low enough to give you the flat, perfect smile. If there's a cant, that means the higher side is the underdeveloped side. And I have the cant in the upper and lower jaw. So this woman had the exact same thing as me. And she needed a double jaw surgery to fix this because if both of your jaws are in a cant, that means they're both uneven or unsymmetrical. So you got to cut them both up to get a good result like this woman did. Next, we have an underbite. So underbites are one of the easiest cases to fix and have some of the most aesthetic results of all time. You can argue that Lefort 1 surgeries just by themselves are just as impressive compared to double jaw surgeries with genioplasty, because when you have a recession of the upper jaw, it's worse, I would say, than a recession of the lower jaw for the most part. It affects your voice, it affects your breathing way worse, especially your nasal breathing. I've met somebody who was extremely recessed in the mid-face. It's like they had a fist punched in their face and, they got smashed in. And they had the most, not rough voice, but it sounded like they were struggling to breathe and talk. It was not good. And it was very high pitched. So if you have an advanced maxilla, usually your voice becomes better and your nasal breathing becomes way better as well. But in this case, she wasn't severely recessed in the lower jaw, so all she needed was the Lefort 1, like I said. But a lot of people do opt in for a double jaw surgery even though they just have an underbite and the lower jaw is fine. It depends on what the goals are, right? Some patients just want their angles to be manipulated and do a counterclockwise rotation. In her case, she didn't need it. She had a pretty good occlusal plane, but she was just recessed in the maxilla. So a Lefort 1 was correct here. And as you can see, oh wait, I stand corrected. So yes, and these cases of underbites, a lot of people do settle for just the upper jaw surgery. But I forgot to mention, these cases are by Dr. Alfie, the doctor who's going to do my jaw surgery. So he always likes to do double jaw surgery for everybody because they want to maximize your airway and your aesthetics. And to maximize the airway, you got to manipulate the mandible, not just the maxilla, right? The maxilla will fix your nasal breathing. The lower jaw fixes your airway breathing in the throat. So because this is Dr. Alfie, he will always push for a double jaw surgery, even if one of your jaws is underdeveloped. But in this case, now that I look at it, she needed some rotation on the lower jaw. You see how it just goes boop, limp, just curves down right away. So with hers, it still curves down here, but they lengthened it and they rotated it slightly, just slightly. And they dropped down the maxilla here, so a downgraft with advancement and a slight genioplasty. This looks like a slight reduction, to be honest. Or actually, let me zoom in. It does look like a reduction, or they just tipped the bone out just slightly. Hard to say. It's a very subtle difference. But like I said, for underbites, you need a Lefort 1 at minimum. And that's all there is to it, guys. So let's recap it. Normal recession, that means you need a double jaw surgery. That's the plan for that. In overbite, you definitely need a lower jaw surgery. But most people go with the double jaw surgery and genioplasty to get the perfect or the most optimal result, just like this guy. If one side of your face is smaller, like you have a cant, like I do, or just asymmetry in general, a double jaw surgery at minimum. And then with an underbite, you need a Lefort 1 at minimum, but most people do a double jaw surgery for the airway benefits. It's interesting. So you can get sleep apnea if your maxilla or your lower jaw is recessed. Interesting. It does make sense though. And that's it.